What is jaundice? Now, jaundice is a common problem. The moment we tell to a patient that you have jaundice, the patient runs away and goes to an Ayurvedic doctor thinking that there is no treatment for jaundice in allopathy. There are a lot of misconceptions regarding jaundice in the public. Today in this talk, I will be discussing some aspects of jaundice so that next time you have jaundice, you understand as to what is the problem and what needs to be done. Now, jaundice is actually a yellow coloration to the eyes and sometimes the skin also. Majority of the times, even the urine also becomes yellow, but there are times in jaundice when the eyes are yellow but the urine is not yellow, and I'll talk about this part a little later. Where from this yellow color comes in jaundice? This is because of a pigment known as bilirubin, which increases in blood in the presence of jaundice. Normally, bilirubin will be less than 1 milligram per deciliter, but if it crosses more than 2 milligram per deciliter, then we start noticing the yellow color in the eyes, and then we say that this patient is having jaundice. Where from this bilirubin comes? Now, we all have red blood cells in our blood which is circulating all the time. These red blood cells have a normal lifespan of about 120 days, and after that they become old and they need to be destroyed, and this happens in the spleen. So we can see here that these are the old red blood cells which will be taken up by spleen and destroyed in spleen, and in the spleen the protein heme will be produced, which is later on converted into bilirubin. This bilirubin then enters the blood. Liver has a job that it has to take up this bilirubin and convert or conjugate this bilirubin so that it can be passed out in the bile. The bile from the liver enters through the bile duct into the intestine, and this intestine will convert this bilirubin by the action of bacteria into stercobilinogen, and thereby it is passed out in the stool. If there is any disruption in this long pathway of bilirubin metabolism, then you can have jaundice. So you will notice that the jaundice can occur because of problems at different levels of bilirubin metabolism. What are the causes of jaundice? Now, basically, we clinicians, doctors, classify jaundice into three types. First one is the prehepatic, that means before the bilirubin has entered the liver. Second is hepatic, and that occurs because of diseases of the liver. And the third type of jaundice is known as obstructive jaundice. That occurs if there is an obstruction to the flow of the bile in the bile duct. So these are the three main types of jaundice, and I will be discussing these three types of jaundice one by one. What is prehepatic jaundice? Now, prehepatic jaundice is that jaundice in which the bilirubin has entered in the blood. This bilirubin is known as unconjugated. It is insoluble in water, and therefore it cannot be passed out by the kidney into the urine. And therefore you will find that in this type of jaundice, the eyes are lemon yellow in color, but the urine is normal in color. There are only two major causes of prehepatic type of jaundice. Either your red blood cells are being destroyed very fast, broken down very fast, so that lot of bilirubin is produced, and the liver cannot handle this large amount of bilirubin which is coming into blood. You might have heard the disease called as thalassemia, in which the hemoglobin is abnormal, and therefore these red cells do not survive very long, and therefore these red cells get destroyed very fast in the spleen and leads to production of a lot of bilirubin. And because of excessive destruction of the red blood cells, there is anemia also. So this type of jaundice is called as hemolytic jaundice. Another very common entity is one in which the liver fails to take up this bilirubin. It will just not take up the bilirubin or not be able to convert the bilirubin into that soluble form by which it can be passed out in the bile. And this is known as Gilbert's disease. This leads to a type of jaundice in which bilirubin is between 3 to 5 milligram, not very high, but remember that in these two conditions, the hemolytic jaundice and the Gilbert's disease, the liver is perfectly normal. And in fact, you do not have to offer any treatment to the liver in these conditions. It's extremely important to know that this type of jaundice exists. We have seen patients who will be going from pillar to post with this increased amount of bilirubin, thinking that they have a serious liver disease, but in fact, they do not require any treatment for liver because of the fact that the liver is normal here. What are the causes of hepatic jaundice? Now, hepatic jaundice occurs because of the diseases of the liver. Basically, you will have two types of diseases, the acute or the recent onset of jaundice or short duration jaundice, and second one is chronic or long standing jaundice. Now, the acute liver disease occurs mainly because of viruses, sometimes drugs, and sometimes because of alcohol. Viruses are an extremely important cause of acute liver disease. This is called as viral hepatitis. Now, we have five major types of viruses which are present. They are called as hepatitis A, hepatitis B, hepatitis C, D and E. Now, these viruses, out of which two of them are spread by contaminated water and food, and they are hepatitis A and E. Now, sometimes this will lead to epidemics of jaundice. The infection by these viruses will lead to epidemics of jaundice because of contamination of a common source of water. Say, for example, a river water becoming contaminated by sewage can lead to epidemics of jaundice. In our country, number of epidemics of jaundice have occurred because of contamination of drinking water, and almost all of them have been caused by hepatitis E. The good thing about hepatitis A and E are that they are self-limiting. In about 3 to 4 weeks time, the patient becomes alright, even if you do not offer any treatment to them. So you don't actually have to give any treatment for hepatitis A and E. On the other hand, the other three viruses, the hepatitis B, C and D, are spread by contaminated blood. So it can be spread by blood transfusion, it can be spread by needle stick injury, meaning thereby contaminated needles, it can be spread by sexual intercourse or by an infected mother to the newborn child. So this hepatitis B, C and D are basically spread by the contaminated blood. 20th July is the World Hepatitis Day. This is the birthday of Dr. Bloomberg. He was the scientist, American scientist, who discovered the hepatitis B virus. After discovering the hepatitis B virus, he was responsible for inventing the hepatitis B vaccine. And this single vaccine has prevented a number of deaths because of hepatitis B virus, leading to cirrhosis and hepatocellular carcinoma. So for that he was awarded the Nobel Prize. The World Hepatitis Day, 20th July, is celebrated in the honor of birthday of Dr. Bloomberg. What is cirrhosis of liver? Now, many times the damage to the liver is long-standing, and when this long-standing damage occurs, it leads to a condition known as cirrhosis of liver. In this cirrhosis of liver, there is a lot of destruction of the cells of the liver, and liver loses its function one by one. Liver is essential for life. If you do not have a properly functioning liver, it is difficult to survive. So if the damage is extensive, patient will be unable to survive. Now, these patients with cirrhosis will not only have jaundice, they can have vomiting of blood because of rupture of the veins which are there in the food pipe. Then you can have collection of water in the abdomen, leading to massive swelling of distension of the abdomen as well as swelling of the feet. These patients can go into coma or loss of consciousness, which is called as hepatic encephalopathy. And finally, all cirrhotics have a risk of developing liver cell cancer. The major cause for cirrhosis are hepatitis B and C virus all over the world, including India. Apart from these viruses, alcohol is another important cause of cirrhosis of liver. And sometimes, after a lot of investigations also, we may not be able to find any cause for the cirrhosis. If we detect the cirrhosis in early stages, therapy can be offered to these patients. For example, if the cirrhosis is caused by hepatitis B virus or C virus, in that situation we have a number of medications which can help these patients in early stages. But if the liver disease is far too advanced, then these medications will not work. And in that situation we have only one option, that is to replace that liver, called as liver transplantation, in which half of the liver from another donor is placed inside the patient's body, and that will start functioning as the liver of that patient, and this patient may recover. The success rate of liver transplantation is pretty good. About 70% would survive a liver transplantation and they may become alright. The problem is the cost involved in this operation, which will cost about 20 lakhs per operation. Moreover, the availability of liver is very low. So in majority of cases of liver disease, we are unable to offer liver transplantation to our patients. Apart from viruses, alcohol is another important cause of liver disease in our country, especially in this part of the country. Alcohol can lead to acute liver disease called as alcoholic hepatitis, or it can lead to cirrhosis. Worldwide, alcohol is the leading cause of cirrhosis all over the world. Unfortunately, we do not have any good medication for the treatment of alcoholic liver disease. The major treatment will be abstinence, or patients should stop drinking altogether and hope that the liver becomes normal. What is obstructive jaundice? Now we have seen that two types of jaundice, prehepatic jaundice and jaundice caused by the liver disease. There is a third type of jaundice which occurs because of an obstruction to the flow of bile, and this type of jaundice is known as obstructive jaundice because there is an obstruction to the flow of the bile. So this bile flows from the liver into the intestine. So if there is any block in this bile duct, it can lead to obstructive jaundice. This block can occur from a stone which may slip out from the gallbladder and block the bile duct, or else it can happen if there is a tumor in this area which is blocking the bile duct. So this type of jaundice is known as obstructive jaundice. How do you identify this type of jaundice or obstructive jaundice? There is a peculiarity in presentation of these patients. These patients, when they have jaundice, they will often have intense itching of their skin all over the body, and then we suddenly start suspecting that this patient might be having obstructive jaundice. Next, we will be asking for an ultrasound of the abdomen, in which we will be able to demonstrate the block. The bile duct will be blocked, and therefore the bile duct will be enlarged, and that can be shown very well by an ultrasound. To know the exact cause as well as the site, we may often require sophisticated investigations like CT scan of the abdomen or MRI of the abdomen. By doing these tests, not only we are able to tell as to what is the exact cause of the disease, of the obstruction, moreover, in the presence of cancer, we will also be able to tell as to how advanced is this cancer. Can we operate these patients properly or not? So these all information we can obtain by doing a CT scan or an MRI scan. Obstructive jaundice can often be relieved by endoscopic measures, a procedure known as ERCP, in which we pass a tube from the mouth into the first part of the intestine known as duodenum, and then we can inject some dye and we can demonstrate this nice stone here. We can catch this stone with the help of a basket or pull it out through a balloon without doing any surgery, this patient will become all right. Another procedure which can be performed by ERCP is the relief of jaundice in patients who have obstruction of the bile duct due to cancer. Now in these patients we can place either a metallic stent like this across the obstruction, or else we can place a plastic stent. Now this will start the flow of the bile, the jaundice gets reduced and the patient's itching comes down. In conclusion, what we have talked is that jaundice is not one disease, it is caused by many diseases. So whenever you have jaundice, you need to go to a doctor, especially if possible go to a gastroenterologist, who will then probably order for some blood tests and do some imaging techniques like ultrasonography of the abdomen. In some cases he may be asking you a CT scan or MRI, and he will establish whether you have that pre-hepatic jaundice or the jaundice due to liver disease, or is it because of an obstruction. The treatment would depend upon the cause of the jaundice, and that would be helpful for the majority of the patient.